I'm a pharmacist at UAB and I work in the surgical intensive care unit. There I take care of a multitude of patients with different surgical problems, transplants, GI surgery, vascular surgery. In doing so, I interact with lots of different surgical teams. The thing I love about my job at UAB is the interaction that we have as a multidisciplinary team. I'm talking to doctors, nurses, respiratory therapists all day long, just trying to improve patient care and do what needs to be done to take optimal care of my patients. At UAB, I have a lot of experience in dealing with the residents, both in a clinical and non-clinical level. I'm highly involved in precepting residents, and showing them what I do on a daily basis and helping them to learn more about intensive care medicine.
Every day I round twice a day. In the morning I round with transplant nephrology, which mainly encompasses patients who are here with complications after transplantation. And later on in the afternoon we round again with the surgery team. So we get to see each spectrum of patient care. And again, we're completely embedded within that patient care. Transplant's just so amazing because it's a nice combination of both ambulatory and inpatient pharmacy. A lot of the pharmacists here are very well knowledgeable on many different fields. So it's very easy to walk up to another pharmacist and say, hey, what do you think about this order? Or what about this dose? Or are you familiar with this kind of indication? I love it here. I don't have to fake it. I'm not going anywhere ever.
I work in the operating room satellite pharmacy. So there's different satellites where the pharmacists work. And I think that this helps you because the pharmacist is able to establish a relationship with the nurses that work within a specific area and the physicians and the different staff that work there. And I like this a lot better than where I did work previously. It was more like everyone was centralized in one place and you didn't get to know the nurses and the staff on the floor as well. So I like being involved on the patient care floors and the opportunity to interact with the other employees at UAB. The technology is, again, very cutting edge. Everything that you need is provided for you here. Everything is automated, and it seems like they're trying to go towards less paper and more things being computerized. And I think that this helps a lot with the record keeping, and it really makes my job easier. I've been really impressed with the new computer system that they've implemented here, and I find that the technology is easy to use and is helpful for all the staff. Birmingham is a great area for young professionals to live in. I think living here, there's always things to do on the weekends when you're off work. It's a urban area, but it's not too big. There's art museums, different cultural things you can do. There's always music venues, different things, lots of shopping. There's a lot to draw you to the city, and I think that it's a good size also. It's not too intimidating if you're from a small town, but it has the big city feel as well. And I think the people are all, very friendly and, easy to get to know and easy to find people to meet. At UAB, I'm not just another pharmacist.